Before Anna got treated, our house was total chaos. It was awful. She was really struggling. We really, at that point, didn't understand much about eating disorders and certainly couldn't understand her behavior at all. So I think we were really frustrated and scared. And then, of course, Anna was struggling. And then her sisters, our other two children, they were confused and scared as well.
Well, I think that was the strength in the family-based therapy, was that it involved our entire family. This was what made the difference for us. This is what changed our lives, changed our daughter's life.
When it comes to dealing with children with eating disorders, there is extensive research that shows the highest rates of success are with family-based therapy. Those of us here at Melrose know it works firsthand because of what we see every day with the families we work with. I'm Dr. Marcus Westerman, a psychiatrist at Melrose.
And I'm Kelly Senesac, a licensed marriage and family therapist here at Melrose. One of the keys to family-based therapy is to understand everyone has a role. The parents have a role, so does the teen with the eating disorder. Brothers and sisters have a role too, and so does the treatment team here at Melrose. No one can fix an eating disorder by themselves, but if everyone embraces their role, together we can. In the next few minutes, you'll see some role-playing situations that will show you what we mean. We'll also talk about the 3 phases in family-based therapy, and you'll hear from a family that was successful using it.
Before we begin, let's talk about a few of the principles underlying family-based therapy. First of all, we still don't know what causes an eating disorder, but we do know eating disorders are not the child's fault or the parent's fault. That's so important to remember because treating an eating disorder can be long, difficult, and emotionally challenging. It may be the hardest thing you and your family ever experience, but it can be successfully treated, and your Melrose treatment team will be with you every step of the way.
Secondly, the parent's involvement is vitally important for success. Parents are the experts on their own children and on family dynamics. They are responsible for their children's health, and so parents are in charge of weight restoration.
Thirdly, your child is under the influence of a significant medical illness. That illness affects their ability to think and reason, especially when it comes to eating and concerns about weight. So, think of the eating disorder as another person in the room that has its own goals that do not match up with your child's.
It's kind of like an alien takes over your child's body. And it sounds like such a crazy analogy, but that is honest to goodness what it was like. And we had to recognize that the things that Anna was doing and the things that she was saying, that wasn't Anna's voice and those weren't Anna's actions. That was the eating disorder that had kind of taken her over. And the family-based therapy does help kind of establish that the child is not the eating disorder and they're not one and the same.
Working as a family, realizing it's no one's fault. You're working against the eating disorder, you're not working against your daughter, you're not working against your spouse, you're all working just to make the eating disorder go away, and being united, and it's a process. It takes a long time.
The treatment team will help coach and guide the parents to come up with the best solutions that fit their family and child. The team will help empower the entire family and be the family's coach during the treatment of the eating disorder.
You may think it goes without saying, parents have unconditional love and support for their child, but when an eating disorder takes over, sometimes it's hard for a parent to show it. Showing your love and support is as important as providing the food. But equally important is establishing that the parents are in charge of the child's food and that the expectation is that the meal is completed. That means starting a regular eating schedule, including 3 meals and 3 snacks each day, which may mean changing your regular routine. Predictability decreases the anxiety for your child, and most importantly, remember that food is the medicine. Make the meals family events. You want as many family members as possible to share the meal with the child. Also, it's vitally important that parents present a united front. If you don't, the eating disorder will play one parent off the other. Parents need to be consistent and firm, and we will help the family to achieve this. Your child's life is at stake, and it's important for parents to remain in charge of their child's health when the child is unable to do it on their own.
We had to learn how to be firm, but very compassionately firm at the same time. And it was kind of removing Anna from having to make those decisions, and we just took that all on. That our role in family-based therapy as parents was, we're in control of this food piece for you, and we love you. Your interest is all that we care about, We are only worried and interested in getting you better. And you don't have to worry about anything. We know what's best for you, and we will be here for you, and we will help you work through that.
And the role of the brother or sister is also important. The child with the eating disorder really needs their siblings' support. Sometimes that's acting as a distraction. Sometimes it's being encouraging. A lot of times it just means being there.
Let's talk about the role of the treatment team. The therapist and medical provider need to be seen on a weekly basis during phase 1. The therapist will help decide how often a registered dietitian is seen. We provide recommendations for psychiatry, physical therapy, and occupational therapy as needed, and will coordinate any care with outside providers. Any question you have is a good question. The treatment team is here to educate, encourage, coach, and cheerlead.
They just gave us the tools to help Anna, and that's what we needed. That's what we didn't have. And Anna needed some tools to help herself too.
You know, through family-based therapy, we learned how to work together as a family and not let her eating disorder, you know, start to kind of tear at the seams of our family.
In my experience, it's the parents who commit to this process who have the greatest success. We know that it is crucial to start out strong and treat this devastating illness aggressively. How long it takes your family depends on a number of factors, but all families go through 3 phases of treatment: weight restoration, returning control of eating back over to the teenager, and establishing a healthy adolescent identity.
Let's start with phase 1, weight restoration. Most of phase 1 is taken up by coaching the parents on how to help their child restore weight. Starvation has very significant effects on not just the body, but the brain. The primary focus at the start of treatment is stabilizing your child's weight and returning to regular eating. So the initial period of treatment does not directly address body image. Much of that comes later. However, we do address behaviors related to body image that make eating and keeping a healthy weight difficult for the child.
The treatment team will help parents figure out how to express their support and empathy for their child. It is important to remember that it is not the child's fault. The eating disorder behaviors are symptoms of the disease that are mostly outside of the child's control.
You just get very angry because it gets to be such a, every meal turns into a long drawn out process. It turns into a battle. You know, the other kids were upset. You were struggling with her. So helping to remove that blame from everyone. It's not her fault. It's not our fault. It's not something that somebody did. It's just something that happened. And then learning to keep the whole process calm and not letting it turn into a battle really made a difference.
We will help coach parents on how to help their child accept that the parents are in charge of his or her eating. A regular eating pattern will help the teen restore to a stable weight. Parents may start to notice they don't have to convince them to eat at the table. Yet it's important to remember that phase 1 will likely be the longest part of treatment. We won't go to phase 2 until your child is nearly fully weight restored and actively participating in recovery. At that point, the family is ready for the second phase. This is when parents help their child take more control over eating.
While the goal of phase 2 is to hand back some of the control over the child's choices when it comes to eating and exercising, the parents get to choose how and when they want to hand back control. Perhaps they start with reducing their supervision of some of the snacks. Perhaps the teen can start sports again. If the child's weight starts to drop, decision-making shifts back to the parents and we return to phase 1. Every child's recovery is unique. It's never a straight line, and your therapist will help parents and the child in making healthy decisions.
And it was kind of scary giving her control back. Kelly taught us how to be really, to really just lay things out. Like, this is what we expect, you know, this is how the meals are gonna go. If you think it's hard or we see something's wrong, you know, we'll take some control back again and support you again until we can see that you're feeling comfortable with it, and then we'll give it back to you.
The third and final phase establishes a healthy adolescent identity. Now that the teenager is out of immediate physical danger and is in more control of their body and regular eating, it's time to sort out who they are. Finding and accepting your adolescent identity is something all teenagers struggle with. The therapist will help the teenager establish a healthy identity and body image. At the same time, the therapist also guides the family in establishing healthy communication and expectations.
Now that the family has come so far, we don't want anyone to go backwards. We make sure that no one is rushing to finish therapy because of some deadline, such as the start of a sports season or going to college.
You know, I think the key is buy-in for the whole family and realizing it's no one's fault. You're working against the eating disorder. You're not working against your daughter. You're not working against your spouse. You're all working just to make the eating disorder go away and being united.
To parents who are in the spot that we were in I would say a couple things. You're not alone. There are other parents who are struggling as well with these same issues, and there is hope. So not to give up, because it feels overwhelming. I mean, you feel it's a very devastating struggle. But you know, I think we learned that it was one of those things that you just have to recognize that it's there, recognize that it's a formidable enemy, and take the big step to get really appropriate intensive care for your child, and learn the skills so that you can help your child get through this.